This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Did you ever think we would be where we are today when it comes to technology? Just talk into this thing and I can be connected to any one of my contacts or control the lights in my home or your heating and air with just a touch of a button. But the same can be said for science. We've come a long way, particularly when it comes to identifying cancer risk. Ashley Lowe is a genetics counselor at PRMC. Thank you so much for joining us.
Thank you for having me.
Yeah, so genetic counseling, for those who are not sure, what is it?
So genetic counseling is really the process of helping patients, individuals, understand really complex genetic information and how that relates to disease and health. Sometimes it's taking into account the different implications, whether that's the medical implications, familial implications, the psychological implications of that information, kind of incorporating that into their life.
Interesting. Now, is this something relatively new in the medical field?
I'd say in the grand scheme of healthcare, yeah, relatively new. The first master's program in genetic counseling was established in 1969, so it's been around for a while. It's definitely grown in its prevalence, probably in part due to just more knowledge about the genome, but also advances in technology and our capabilities when it comes to genetic testing. It's definitely exploded in the last few years.
All right, so explain the process for anyone interested in pursuing genetic counseling.
Yeah, the process starts with obtaining information. So that's gathering personal history information, family history information. The genetic counselor uses that information to come up with a thorough risk assessment, particularly, coming into Breast Cancer Awareness Month, thinking about cancer genetic counseling, using that information to then make decisions about genetic testing. It's always an option that would be available for individuals, but it's not always the best fit. So talking with a genetic counselor gives you the opportunity to pursue testing if you'd like, and then using that information to make decisions about medical management, screening, prevention.
Yeah.
So it's a whole process, but it starts with gathering information and doing that risk assessment.
Right, and information is power a lot of times. Yeah. Okay, so talk to us about some of the results you've seen, particularly when it comes to breast cancer.
Yeah, so the thing about the results is that that's just one part of the testing process. The really important part is the preparation for those results. So kind of making sure that you're aware when you go into genetic testing that you might get something you don't expect. So whether that's understanding about your risk for breast cancer, kind of recognizing that you're at an increased risk over the general population, knowing that information then empowers patients to make some more proactive steps in their health management. So yeah, you can get results that maybe you weren't expecting, but then, like you said, knowledge is power, using that information to make decisions going forward.
Yeah. So waiting for the results, does it take long to get them?
It can. It depends on your genetic test. Really, with, like I mentioned before, the advances in technology has really expedited that process. We can get results typically within about 2 to 3 weeks, depending, again, on the type of testing that you're doing. For individuals who maybe have a more recent diagnosis of breast cancer, who maybe want that genetic testing information to make decisions about their surgical plan, for example, we can do expedited results. Those can happen in as little as 7 to 10 days to try to keep that management plan rolling.
But again, that's just a small part of the entire genetic counseling. Okay, so PRMC is holding a free breast cancer conference on October 3rd where people can learn more about genetic testing and counseling.
Absolutely, we're going to be presenting on the whole process. So the genetic counseling process, advances in technology, how physicians are using that information to make management decisions in regards to chemotherapy treatment, surgical decisions. You also hear from families who have had genetic testing and what that process was like from their side of things as well.
It's really fascinating, and I feel like we're just at the tip of the iceberg with this. Would you agree?
Absolutely. It's as I mentioned, it's exploding, and it's something that I learn something new every day. We're uncovering new advances when it comes to how can we use this information to improve quality of life, and I think that's the best part about it.
Wow. So, all right. Yeah. Ashley Lowe, genetic counselor with PRMC. Thank you so
you.
much. Again, the Peninsula Regional Medical Center's free breast cancer conference is Wednesday, October 3rd at the Wicomico Youth and Civic Center, 4:30 to 7:30 p.m. Thank you, Ashley.
Thank you.